think you matter here? You're nothing." He said it the moment before he grabbed her, his fist closing around Miriam Gray's hair, yanking her head back so hard her neck cracked. In front of everyone, in the middle of a trauma bay full of dying patients, Dr. Harrison Jones, chief of trauma, untouchable, worshipped, had just put his hands on a nurse like she was furniture he needed to move. The room stopped breathing. Monitors screamed. Nobody moved. They were all waiting for her to cry, to crumble, to apologize for existing. What happened next, nobody in that emergency room would ever forget for the rest of their lives. Before this night was over, Dr. Harrison Jones would be on the floor, staring up at the ceiling, understanding, for the very first time in his privileged, untouchable life, what it felt like to be powerless. If you're new here, please subscribe and follow this story all the way to the end. Drop your city in the comments. I want to see how far this story travels. The morning shift at Metropolitan Mercy Hospital always started the same way. The fluorescent lights hummed to life at 5:45. The overnight nurses handed off their charts with heavy eyes and coffee cups, and the trauma bay filled slowly with the particular brand of controlled chaos that defined a Level 1 trauma center. For most people, walking into that environment felt overwhelming. For Miriam Gray, it felt like home. She moved through the department the way water moves through a landscape, quiet, efficient, finding the path of least resistance without drawing attention to itself. She had been a trauma nurse at Metropolitan Mercy for 3 years, and in those 3 years she had learned one thing above everything else. Visibility was a liability. Keep your head down. Do your job. Let the doctors believe they were the smartest people in the room. It was easier that way. And Miriam Gray was, above all things, a woman who understood ease. She wasn't thinking about any of that, though, on the morning everything changed. She was thinking about Mr. Henderson in Bay 4. Gerald Henderson was 67 years old, a retired school teacher from the east side of the city who had come in the night before complaining of chest tightness and mild shortness of breath. The overnight team had run an initial workup, troponin levels borderline, EKG showing minor irregularities, and had flagged him as a possible unstable angina case. He'd been admitted for observation. Standard protocol. Nothing that should have put him on anyone's radar as a critical concern. Except Miriam had been watching him for 2 hours. She'd come on shift at 6, taken her assignment, and started her rounds. Mr. Henderson had greeted her with a tired smile and a joke about hospital food that she suspected he'd told every nurse who'd come through his curtain. She'd laughed politely, checked his vitals, adjusted his telemetry leads, and then stood at the foot of his bed for an extra 30 seconds longer than was strictly necessary, studying his face. There was something wrong. She couldn't explain it the way a textbook would want her to. She couldn't point to a single number and say, "There, that's the problem." It was a feeling built from years of experience she never talked about. It was the way his color had shifted, not dramatically, just subtly, like a photograph with the contrast turned down half a notch. It was the way he was breathing, each inhale a little more deliberate than the last, as if he was concentrating on something the rest of his body was trying to forget. It was the way his left hand, resting on the blanket, had curled slightly inward at the fingers. Small things, invisible things, to someone who hadn't been trained to notice invisible things. Miriam had spent 8 years being trained to notice invisible things. She pulled up his overnight readings on the monitor, cross-referenced his medication log, and then went directly to the nursing station to pull the attending on record. Dr. Harrison Jones had rounds starting at 7. She had 40 minutes. She documented everything she observed, every small deviation, every subjective concern, every number that hadn't crossed the threshold of alarm but was trending in a direction she didn't like. And she clipped it to the front of Mr. Henderson's chart, flagged in red, with a handwritten note that read, "Possible ACS progression. Recommend urgent cardiology consult and repeat troponin before rounds." She thought that would be the end of it. She was wrong. Dr. Harrison Jones arrived at 7:03, which was already notable because Dr. Jones did not arrive late. His punctuality was one of the few things about him that everyone in the department agreed upon. He was impeccably dressed, as always, pressed white coat over tailored slacks, his name embroidered in navy thread above the breast pocket, hair silver and deliberate. He walked the way powerful men walked when they had never once been made to doubt their power, like the floor existed for the sole purpose of bearing his weight. Miriam was at the station when he came in. She watched him pick up the stack of charts without slowing his pace, watched his eyes scan the room with the practiced efficiency of a man who had performed this exact ritual 10,000 times, and watched his face when he reached Mr. Henderson's flag. He stopped. He looked at it. Then he looked at Miriam. "Who wrote this?" he said. Not a question, a challenge. "I did," Miriam said. She kept her voice neutral, her hands loose at her sides. "Mr. Henderson in Bay 4. I've been monitoring him since 6 o'clock. His presentation has changed from the overnight notes." "I can read," Dr. Jones said. The nursing station fell quiet. Two residents who had been pretending to review charts suddenly found reasons to look somewhere else. "His troponins are borderline," Jones continued, flipping through the chart with one hand, his tone carrying the specific kind of dismissiveness that was more dangerous than anger. The dismissiveness of a man who had already decided the conversation was beneath him. "Borderline means watching. It doesn't mean urgent consult requests." "His color has changed," Miriam said carefully. "His breathing pattern is different from 2 hours ago. He's showing subtle signs of—" "Nurse," he said the word the way some people said it, as a ceiling, a limit, a reminder of where the conversation was supposed to stop. "His vitals are within normal parameters. His EKG this morning shows no acute changes. He is a 67-year-old man who ate a large meal, sat in traffic, and worried himself into chest tightness. He will be discharged after his repeat labs this afternoon, pending unchanged results." He snapped the chart closed. "Is there anything else?" Miriam looked at him. She looked at him the way she had once learned to look at things in the dark. Not confrontationally, not with challenge, but with a quiet, steady attention that took in every detail without revealing what she was thinking. "I'd like my concerns documented," she said. Something shifted in his face. It was brief, almost imperceptible, a tightening around the eyes, a slight flare at the bridge of the nose. He had not expected her to say that. People did not usually push back on Dr. Harrison Jones. Not directly, not quietly, without flinching, like they were simply stating a preference about how they took their coffee. "Document whatever you like," he said. "It's a free country." And he turned and walked away. Miriam watched him go. Then she turned back to her station, opened Mr. Henderson's digital record, and began typing. The next 2 hours passed with the ordinary rhythm of a trauma department morning. 2 motor vehicle accidents, a septic patient transferred from a long-term care facility, a pediatric case that resolved faster than anyone expected and left the room lighter for it. Miriam moved through all of it with the same quiet efficiency she always did, checking on Mr. Henderson between cases, documenting every observation with the kind of precision that left no room for ambiguity. At 9:15, she was passing Bay 4 when she heard it. A sound she recognized before she consciously processed it. Not an alarm, not a shout, but a change in the quality of the silence behind the curtain. A held breath, a stillness that wasn't restful. She pulled the curtain back. Gerald Henderson was gray, not the subtle shift she'd noticed at 6 o'clock, but truly gray, his skin the color of old concrete, his mouth slightly open, his eyes carrying that particular unfocused quality that she had seen in other places, in other circumstances, that she had trained herself never to associate too quickly with finality, but also never to ignore. "Mr. Henderson," she said, moving to his side. Her fingers were already on his wrist before she finished saying his name. "Hurts," he said. His voice was thin, surprised, like pain had arrived as an uninvited guest and he hadn't had time to prepare. Chest. It started about, "I've got you," Miriam said. She had already reached the call button, already hit the emergency alert. "I've got you. I need you to stay with me, okay? Can you do that?" He nodded, but the nod was weak, and his hand had closed around her wrist, the way people held onto things when they were afraid of falling. The next 4 minutes were a controlled storm. The telemetry alarm went live across the station as his rhythm broke from the irregular pattern she'd been watching all morning into something unmistakably dangerous. ST elevation across multiple leads, a pattern so classically anterior STEMI that every resident who ran into the bay recognized it before the attending was even paged. Miriam was already managing his airway, already calling for the crash cart, already rattling off the sequence of interventions she needed in the clipped, precise language of someone who had coordinated emergencies in environments where there were no crash carts, no defibrillators, no clean floors, no backup coming. Dr. Jones arrived at 4 minutes and 12 seconds, which she noted without meaning to because her brain still kept time that way. "What happened?" he said, taking in the scene. "STEMI," Miriam said. She didn't look up from what she was doing. "Anterior. He's been showing progression since 600. I have full documentation." The words landed between them like a stone dropped into still water. She felt the ripple of them without looking at his face. She heard it in the half-second pause before he moved to the patient's other side. In the slightly too controlled way he said, "Get cardiology on the phone." In the careful absence of anything that acknowledged what she had just said. Cardiology was called. The cath lab was activated. Gerald Henderson was wheeled out of Bay 4 at 9:22, alive, his hand releasing Miriam's wrist, with a grip that was already stronger than it had been 10 minutes ago. She stood at the edge of the bay, watching the team move him down the corridor, and she felt the familiar things she always felt in those moments. Not triumph, not vindication, just a quiet, steady relief, like a knot releasing in a muscle she hadn't realized she'd been clenching. Then Dr. Jones was beside her. He presented ambiguously, Jones said. He wasn't looking at her. He was watching the corridor where the transport team had disappeared. The overnight workup didn't flag anything critical. Miriam said nothing. "These things develop," he continued, and there was something in his voice she recognized. Not quite an apology, not quite an explanation, but the structural suggestion of one, the frame of it without the willingness to fill it in. "Yes," Miriam said, "they do." She walked back to the nursing station. The morning moved forward. Cases came in and moved out. The department found its rhythm again, and Miriam Gray went back to being invisible, checking vitals, updating charts, answering call lights, existing in the particular marginalized space that the hospital had built for nurses who didn't challenge the hierarchy out loud, who absorbed the friction of arrogant medicine and kept moving. She was used to it. She had been invisible in far more dangerous places than this. What she didn't know, what none of them knew yet, was that the morning's events were not the story. They were only the setup. The story was coming at 2:47 that afternoon, when the radio at the ambulance bay crackled to life with a single transmission that changed the temperature of the entire department in under 30 seconds. "Metropolitan Mercy, this is Medic 14. We have a confirmed mass casualty event. Interstate 43, multi-vehicle. Current count is 19 patients, 7 critical, 2 pediatric. First unit's ETA 6 minutes. How copy?" The charge nurse, Deborah Wills, picked up the radio. Her voice was steady. "Copy, Medic 14. We are activating MCI protocol. Bay is clearing now." And then the department shifted. Mass casualty protocol at Metropolitan Mercy looked, from the outside, like organized chaos. Staff materialized from hallways and break rooms. Supply carts appeared from storage. Overflow bays were unlocked and readied. And the triage tag system, Those simple colored tags that decided, with brutal clarity, who got resources and who waited, was distributed to the team leaders at the door. Miriam had been through mass casualty activations before at Mercy. She had also been through them in places that were not hospitals, in conditions that were not controlled, in situations where mass casualty was not a medical protocol, but a simple description of what had happened to the people around her. She did not think about those situations while she worked. She had learned, a long time ago, to keep those two versions of herself in separate rooms. She moved to her assigned station, checked her supplies, confirmed her team, and waited. Dr. Jones was at the center of the floor, taking the initial briefing from the charge nurse. Miriam watched him from across the room with the peripheral attention she'd developed years before she ever worked in a hospital. The kind of attention that tracked everything without appearing to focus on anything. She noted the set of his jaw, the slight rigidity in his posture, the way he was holding the triage list with both hands when one would have been sufficient. She had seen that particular body language before too. Not on doctors, on officers, on men who led from authority rather than competence, and who had never, not once in their careers, been placed in a situation where authority alone wasn't enough. The first ambulances arrived at 2:53. The bay doors opened and the world poured in. She worked. She worked the way she always worked, methodically, economically, without wasted motion, without the particular emotional turbulence that consumed some of her colleagues in high-volume emergencies. She assessed, she prioritized, she communicated in the clear, direct language that cut through noise and got things done. And she moved from patient to patient with a fluidity that several of the newer staff would later describe, in hushed conversations they weren't sure how to have, as remarkable. For the first 20 minutes, the system held. Everyone did their jobs. The triage system functioned as designed. Critical patients went to the right bays. Walking wounded were managed in the corridor. The pediatric cases were routed to the peds team on standby. Then it started to fracture. It began with a communication breakdown between the receiving desk and the trauma team. A critical patient who had been tagged red at the scene, arriving without his paperwork, his condition more severe than the initial radio report had indicated, his airway already compromised in a way that required immediate intervention. Miriam was 3 bays away when she heard the confusion, the crosstalk, the rising volume of voices trying to establish who was managing the patient and what protocol they were following. She crossed the floor in 11 seconds. "I've got airway," she said, moving to the head of the bed without hesitation. "Someone call me vitals, now." "Sats are dropping," the tech said. 78 and falling. "Push position," Miriam said, already adjusting. "Get me a laryngoscope, 7.5 tube, and 10 of succinylcholine. Who's the attending on this bay?" "That's..." The resident looked around. "Dr. Jones assigned himself to critical overflow." "Then get Dr. Jones," Miriam said. "Now, loudly." She had the airway managed, not fully secured but stabilized, the patient's sats beginning their climb back up. By the time Dr. Jones arrived at the bay, she could hear him before she saw him, his voice carrying across the floor with the particular sharp edge it got when things weren't going according to the ordered world he expected. "What is the situation in this bay? Why was I not notified immediately that this patient..." He stopped. He saw Miriam. He saw the patient, saw the tube, saw the numbers on the monitor trending upward from a floor that had been very close to the kind of irreversible. Something moved across his face. She caught it only because she was watching for exactly that kind of thing. A flash of something that was not quite anger and not quite embarrassment, but lived in the complicated territory between them. His jaw set, his eyes moved from the patient to Miriam and back to the patient. "Get me the full assessment," he said, and his voice was controlled, professionally controlled. The voice of a man who had redirected himself so smoothly that anyone not paying close attention might have missed the redirection entirely. Miriam gave him the assessment, concise, accurate, complete. She gave him everything he needed to take over the case and manage it forward. And she stepped back the moment he took hold of it, moving without ceremony back into the flow of the floor. She was 15 feet away when she heard his voice rise. This patient should have been intubated at the scene. Who cleared this man's airway assessment before transport? Where is the paramedic team leader? I want a complete accounting of every decision made in this chain from the point of injury to this bay. And I want it in writing, and I want it. Dr. Jones. It was the charge nurse, Deborah, her voice carrying its own kind of authority, the quiet authority of a woman who had worked trauma for 22 years and had learned exactly which fires needed water and which ones needed air taken away. The patient is stable. We have 14 other actives on the floor. What do you need right now? There was a pause that lasted slightly too long. I need people doing their jobs, Dr. Jones said, and he turned away from Deborah, away from the stable patient, away from the acknowledgement of what had just happened, and swept his gaze across the trauma bay like a general surveying a battlefield that was not behaving the way the maps said it should. His eyes found Miriam. She was at the next bay, already assessing the next patient, already in motion, already doing exactly what needed to be done in the exact way it needed to be done. She wasn't looking at him. She wasn't performing awareness of him. She was simply working with that particular quality of focused competence that had, over the course of the last 20 minutes, become the most visible thing in the room, more visible than his white coat, more visible than his name embroidered in navy thread, more visible than the authority he carried like a shield he'd never once had to test. And Dr. Harrison Jones, who had built his entire professional identity on being the most capable person in any room he entered, felt something he had not felt in a very long time. He felt the room shifting around him. Not dramatically, not with announcement, just quietly, the way tides shift. The staff moving with a slightly different orientation, the residents glancing toward Miriam when they needed direction, and toward Jones when they needed permission. A distinction so subtle that most people would never have noticed it. But Harrison Jones noticed it. Because Harrison Jones had spent 30 years monitoring exactly that kind of room dynamic, and he knew, with the particular sick certainty of a man watching his foundation develop a crack, that something was happening that he did not know how to stop. And in that moment, that precise, combustible moment when competence and ego collided in the middle of a mass casualty event, the thing that had been building all day long reached its ignition point. He moved across the floor toward Miriam Gray. She was mid-assessment, her back partially turned, both hands occupied with a patient, her full attention directed at the work in front of her, completely unaware that 40 feet behind her, something was coming that would change every single life in that room. The monitors beeped. The overhead lights hummed. Somewhere down the corridor, a radio crackled with the next incoming unit, and Dr. Harrison Jones reached out his hand. His fingers closed around her hair at 2:59 in the afternoon. She felt it before she fully processed it. The sudden, sharp pressure at the back of her skull, the jerk that snapped her head backward and pulled her off balance mid-motion, the sound of her own breath catching in a way she had not heard from herself in years. Her hands were still on the patient. That was the first thing her brain registered, even before the pain, even before anything else. Her hands were on the patient, and the patient needed her hands there. "I am talking to you," Dr. Harrison Jones said. His voice was low, which was worse than loud. Low meant he had made a decision. "When I speak, you stop what you are doing and you look at me." The bay went silent, not gradually, not in the rippling way that silence usually moves through a room, person by person, conversation by conversation. It went silent all at once, like someone had cut a wire. Monitors kept beeping. The ventilator in Bay 6 kept cycling. But the human noise, the voices, the movement, the constant ambient sound of 30 people doing urgent work, that died completely in under 2 seconds. Everyone heard it, everyone saw it. Every nurse, every resident, every technician, every paramedic still finishing their handoff at the door. They all turned, and they all went still. Deborah Wills, the charge nurse, stood 8 feet away with a chart in both hands. She would later say that her first thought was that she had misread the situation, that her brain had refused, for a full half-second, to accept what her eyes were telling her, because what her eyes were telling her was simply not something that happened. Not here, not in a hospital, not by a physician with 30 years of credentials behind his name. And yet there it was, happening, in front of every witness the department had to offer. Miriam did not move. This was the thing nobody in that room expected. She did not flinch. She did not cry out. She did not reach up with both hands to try to pull his grip loose, which would have been the natural, unthinking human response to that kind of pain. She went absolutely, completely still. A stillness so total that it transformed the quality of the moment, turned it from an act of violence into something that suddenly felt, to every person watching, like the worst mistake Harrison Jones had ever made in his life. Her patient, a 42-year-old man with a traumatic chest injury, still conscious, still aware, looked up at her face from the gurney. "Ma'am," he said, his voice rough with pain and something that might have been outrage on her behalf. "Ma'am, are you—" "Shh," Miriam said, quietly, steadily, to the patient. "I have you. Don't move." Jones yanked again, harder. "You do not give me—" "Shh," he said. "You have been undermining my authority in this department since 6 o'clock this morning, and I am done." "Dr. Jones." Deborah's voice cut across the floor like a scalpel. Clean, precise, no wasted energy. "Release her, right now." He didn't. And that was the moment, the precise, defining, irreversible moment, when Dr. Harrison Jones stopped being the most powerful person in the room and became something else entirely. Miriam's right hand came down from the patient's chest. Her left hand maintained contact. Light, steady, a simple reassurance that she had not abandoned her post. Her right hand moved with a deliberateness that was, in its own way, more frightening than any reactive speed could have been. Deliberate meant chosen. Deliberate meant she had assessed the situation, made a decision, and was executing it. She reached up and found his wrist, not to pull his hand away, not to beg or struggle or negotiate with the grip. She found the specific point on the inner aspect of his wrist, radius against ulna, the particular junction of bone and nerve that she had learned to locate in total darkness, under conditions that made a busy trauma bay feel like a meditation retreat. And she applied pressure. Precise pressure. Calibrated pressure. The kind of pressure that communicated, without a single word, that she knew exactly what she was doing, and that what she was doing could become considerably worse if he chose not to respond to it. Jones's hand released. Not dramatically, there was no shout, no theatrical collapse. His fingers simply opened, the way a fist opens when the signals that were holding it closed suddenly stop arriving. And Miriam stepped to her right, turned, and faced him. She was calm. That was the word every person in that room would reach for later, when they tried to describe what they had witnessed. Not brave. Brave implies fear being overcome. Not angry. Anger would have been readable, manageable, something they could have understood. Calm. The particular, absolute, unperformed calm of a person for whom this situation, being grabbed, being threatened, being made to feel small in front of witnesses, was simply not the most dangerous thing they had ever faced. Not even close. "Sir," she said, "you need to step back." Jones stared at her. His wrist was still raised, half extended, as if he hadn't fully understood yet that it was empty. His face was doing something complicated, cycling through the stages of a man who had acted without thinking and was now, in real time, confronting the consequences of that. There was confusion. There was something adjacent to pain, though the pressure she'd applied had not been sufficient to cause real physical harm. And there was, beginning to surface beneath both of those, a rage so clean and so old that it must have been there, Miriam thought, since long before this afternoon, since long before she ever walked into his department. "You," he said, and his voice had dropped to something very quiet, which in Miriam's experience was always the register to watch most carefully. "Have no idea who you are dealing with." "I know exactly who I'm dealing with," Miriam said. Her voice carried the same way a sound carries in an empty church, without effort, to every corner of the space, reaching everyone without being aimed at anyone in particular. "And right now I need to get back to my patient." She turned her back on him. She turned her back on Dr. Harrison Jones, the chief of trauma, in front of the entire department, and went back to work. The room did not explode. It imploded. A collective internal detonation. 30 people absorbing the same moment of recognition simultaneously, none of them certain what they had just seen or what it meant. All of them certain they would never forget it. Dr. Reyes, the second-year resident who had been on the floor since 7 that morning, would later say to his wife, in their kitchen, very quietly, that watching Miriam turn her back on Jones had been one of the most frightening and simultaneously most impressive things he had ever witnessed. His wife would ask him which part, the frightening or the impressive. He would think about it for a long time before saying, both, at the same time. That was the thing. Jones did not move for 4 seconds. 4 seconds is not a long time in most contexts. In a trauma bay, 4 seconds is an eternity. It is long enough for a blood pressure to drop 15 points, long enough for a rhythm to break, long enough for every person in the room to understand that the man standing in the middle of the floor was not moving because he did not know what to do next, and that this simple absence of a next step was something that had possibly never happened to him before. Then his pager went off. The sound broke something in the room. People started moving again. The charge nurse, Deborah, turned deliberately away from Jones and toward her station. And the deliberateness of that turn, the refusal to give him an audience, was its own kind of statement. The residents found their patients. The techs found their tasks. Jones looked at his pager, looked at the room, and walked toward his office. Miriam heard his footsteps cross the floor. She did not turn around. She continued her assessment, continued documenting, continued doing what needed to be done, and she kept her breathing even and her hands steady, and she did not think, did not allow herself to think, about the thing she had felt when his hand closed around her hair. Not the pain, the recognition, the deep, cold, instantaneous recognition of that specific sensation, that specific dynamic, that specific kind of certainty on the part of the person doing harm that they would face no consequences for it. She had felt that before, in different rooms, under different circumstances. She had learned in those rooms that the worst thing she could do was let that recognition live in her body, take up residence in her hands and her chest and her jaw. She had learned to root it somewhere else, somewhere it could be used. She filed it away, neatly, cleanly, the way she filed everything. The next 22 minutes were the busiest of her career at Metropolitan Mercy. The MCI, mass casualty incident, was reaching its peak volume on the floor at 3:04 when Medic 7 radioed in a status change on the final transport. 3 patients they'd initially tagged yellow had deteriorated to red during transport. 2 were pediatric. The floor, already stretched to its operational limit, had to absorb 3 critical patients in a system that had been designed for 2 more critical slots at maximum. Deborah was on the radio. Her voice was steady, but Miriam could hear in it the particular frequency of a person doing math in their head and not liking the numbers. Copy 7. We are triaging overflow to the secondary bay. What are pediatric ages and weights? 6 and 9. Approximate weights 22 and 30 kilos. 6-year-old has head trauma with altered LOC. 9-year-old is cardiac, Possible blunt injury to the chest. Rhythms irregular. Miriam was already moving. She didn't wait for an assignment. She didn't wait for the charge nurse to allocate resources or the attending to make a decision. She moved to the supply station, gathered what she needed for the pediatric cardiac case, and was halfway to the secondary bay when she heard Deborah behind her. "Gray, Peds cardiac is yours." "Already on it," Miriam said without turning around. The 9-year-old's name was Callie. Miriam learned this from the paramedic in the first 30 seconds of the handoff. Not because she needed it clinically, but because she always learned names. Names mattered. Names were the difference between treating a body and treating a person. And Miriam Gray had never once in her career treated a body. Callie was conscious but frightened in the specific way that children are frightened when they cannot locate their parents and do not understand what is happening to them. Not crying, not screaming, but very still and very pale, her eyes tracking every face that moved through her field of vision with an expression that was almost unbearable to look at directly. "Callie," Miriam said, positioning herself directly in the child's sightline. "My name is Miriam. I am going to take care of you. Can you tell me if anything hurts right now?" "My chest," Callie said. Then, "Where's my dad?" Miriam held the girl's gaze. "We're going to find your dad. I promise. First, I need to make sure your heart is okay. Is that all right with you?" Callie looked at her for a long moment. The assessment that children make of adults, that unfiltered, unperformed reading of whether the person in front of them is telling the truth. Then she nodded. "Good girl," Miriam said. "I've got you." The rhythm on the monitor was irregular, a pattern consistent with commotio cordis, cardiac disruption from blunt chest impact. It was treatable. It required immediate intervention and very careful management, but it was treatable, and Miriam knew exactly what to do. She began the protocol, called for the pediatric cardiologist on call, and managed the case with the same efficient, unhurried attention she brought to everything, all while keeping one part of her awareness on Callie's face. The color, the eyes, the subtle moment-to-moment changes that numbers on a monitor could not always capture in time. It was during this, at 3:17, while Miriam was on the phone with the pediatric cardiologist giving a concise, verbal summary of Callie's presentation, that Dr. Jones reappeared on the floor. She heard him before she saw him. Not his footsteps this time, his voice, in the doorway of the secondary bay, speaking to someone in the corridor. She caught fragments. Unacceptable, chain of command, formal documentation, and she understood immediately what was happening. He had spent 17 minutes in his office constructing a narrative, a framework in which the events of 259 could be restructured, in which a physician under extraordinary stress had attempted to redirect a nurse who was acting outside her scope, and in which the nurse's response had been the problem. She had seen that particular reframe before too, in other places, by other people. It was one of the oldest moves there was. She finished her call with a cardiologist. She checked Callie's rhythm, improving, the disorganized pattern beginning to organize itself in response to the intervention. She documented everything with the precision she had maintained all day. And then she stepped out of the secondary bay into the corridor. Jones was at the nursing station. He was speaking to a man Miriam recognized as the hospital's patient care director, a tall, administration-shaped man named Paul Garrett, who wore his authority the way most people wear a coat they're not sure fits them. Jones was speaking. Garrett was listening with the attentive, non-committal expression of a man who understood that his job, in this moment, was to absorb information without committing to anything it might require him to do. 3 nurses were within earshot. All of them were pretending not to listen. All of them were listening with total, concentrated attention. Miriam walked directly toward them. She did not slow her pace. She did not adjust her expression or her posture or the direction of her gaze. She walked toward the nursing station the way she walked toward everything, directly, without performance, as if she had already assessed the situation and determined her course of action before anyone else in the room had finished deciding whether to react. Jones saw her coming. His sentence trailed off. Garrett turned. "Mr. Garrett," Miriam said. She stopped at a distance that was professionally appropriate, not confrontational, not deferent. The distance of a person who understood the room clearly. "I'd like to make a formal statement regarding the events at 14:59 today." Garrett looked at Jones. Jones looked at Miriam. The three nurses who had been pretending not to listen stopped pretending. "Miss Gray," Garrett said, and his tone was the careful, measured tone of a man navigating a situation he had not been briefed for. "I think it might be more appropriate to schedule a formal—" "I have 30 witnesses," Miriam said. Her voice was not loud. It did not need to be. "Every one of them saw Dr. Jones physically grab me by the hair while I was managing an active patient. I have it documented in the patient record, time-stamped, with my clinical notes from the preceding assessment." She paused, not for effect, because she was giving him the time to process what she had just said. "I would like to make my formal statement now." The corridor outside the nursing station was not, strictly speaking, part of the active trauma floor, but it was close enough that voices carried, and in the particular silence that followed Miriam's words, voices carried very far. Garrett looked at Jones again. Jones said nothing. He said nothing because there was nothing to say. Not in this moment. Not in this corridor. Not with 30 witnesses and a time-stamped patient record and a woman standing in front of him who was looking at him with that same steady, unreadable attention she had directed at him all day. The attention of someone who had been waiting, patiently and without urgency, for exactly this. "Of course," Garrett said. His voice had changed. The careful neutrality was still there, but underneath it, something had shifted. The slight, almost imperceptible recalibration of a man who has just understood that the story he walked in expecting to hear is not the story he is standing in. "Of course, Miss Gray, we can do that right now." Jones made a sound, a short, contained sound that was not quite a word and not quite not one. He turned away from Garrett, away from Miriam, and his eyes moved across the floor, across the busy, continuing, unstoppable work of the trauma bay, and Miriam saw it happen, saw the moment his gaze found Bay 4, the bay that had been Gerald Henderson's bay, the bay where, that morning, he had dismissed her concerns with the particular casual brutality of a man who had never been asked to doubt himself. The bay where a retired schoolteacher had been wheeled out alive because she had trusted what she knew and documented every word of it. His face changed, not much, not enough that Paul Garrett would have noticed it, but Miriam noticed it. She noticed the small, involuntary dropping of his jaw, the slight tension that moved through his neck, the thing that happened behind his eyes. Not remorse, not yet, not something that clean, but a first, raw, unwilling encounter with the possibility that he had been, not just this afternoon, but perhaps for longer than this afternoon, the kind of man he would not choose to be if he were watching himself from the outside. She did not comment on it. She did not need to. "Mr. Garrett," she said, "I need 5 more minutes with my patient before I step away. She's 9 years old, and I told her I wouldn't leave without saying goodbye." Garrett nodded. "Of course." Miriam walked back to Callie. The girl's rhythm was stabilizing. The numbers on the monitor were moving in the right direction with the steadiness of something that had been caught in time. Callie was still pale, but less frightened, her eyes tracking Miriam's face with that same evaluating attention from before, except that now there was something else in it, something that had not been there when they first met, something that looked, unmistakably, like trust. "How are you doing?" Miriam asked her, pulling up the stool and sitting, not standing over her, not leaning over her, but sitting at eye level, the way you sit with someone whose fear you take seriously. "Better," Callie said. "My chest doesn't hurt as much." "Good, that means what I gave you is working." Miriam checked the monitor one more time. Then she looked at the girl. Your cardiologist is coming. Her name is Dr. Park, and she's very good. You're going to be okay. Callie was quiet for a moment. Then she said, that man, the one who, were you scared of him? Miriam looked at her, 9 years old, lying on a gurney after a car accident, and she was asking that. No, Miriam said, and it was the truth, not bravado, not performance, just the plain, flat truth of someone who had drawn their fear threshold in a different place than most people, drawn it after experiences that had permanently recalibrated what fear required to be earned. Callie studied her. I don't think I believe you, she said. Miriam almost smiled. That's okay, she said. You don't have to. She stood up, squeezed the girl's hand once, a brief, firm pressure that said everything she didn't put into words, and walked back toward the nursing station. Paul Garrett was waiting. A woman Miriam didn't recognize was with him now. HR, by the look of her, arrived faster than should have been possible, which meant someone had made a call before Garrett even came down to the floor. Someone had been anticipating this. Dr. Jones was gone. Miriam noted his absence without remarking on it. She sat down across from Garrett and the HR woman, folded her hands on the table in front of her, and began to speak. Calmly, completely, in the precise, sequential, emotionally level language of someone who had been trained to give accurate reports in conditions where accuracy was the only thing that stood between one outcome and a very different one. She told them everything. She told them about 6 o'clock in Mr. Henderson's color. She told them about the flag on the chart and the dismissal at rounds. She told them about the STEMI and the cath lab and the timestamps that documented every step of every decision she had made and every decision that had been made in response to her. She told them about 259, and she told it plainly, without drama, without embellishment, the way you tell a story when you have no need to make it worse than it already is, because the truth is already the worst version of it. And when she finished, the HR woman looked down at her notes, and Paul Garrett looked at the table, and the trauma floor continued its work outside the door. And somewhere down the corridor, Callie's heart beat in a rhythm that was steadily, unmistakably becoming its own again. It was 3:41 in the afternoon. Miriam Gray had been on shift for 9 hours and 41 minutes. She had not taken a break. She had not eaten. She had not, until this moment, sat down. She sat now, in a chair in a conference room adjacent to the trauma floor, and she breathed. Once, twice. The particular, deliberate way she breathed when she was allowing herself to feel the weight of something she had been holding at a distance while there was still work to do. She was not shaking. She was not crying. She was not doing any of the things that the HR woman across the table seemed, from her careful, watchful expression, to be prepared for. She was simply present, here, in this room, in this body, in this life she had built, brick by patient brick, on top of everything that had come before it. And then Garrett's phone rang. He looked at the screen. His face changed. He stood up halfway from his chair, then sat back down, then looked at Miriam with an expression she had not yet seen from him. Not the administrative caution, not the measured processing, but something raw, something struck. Miss Gray, he said slowly, the patient in the cardiac cath lab this afternoon. He stopped, checked his phone again. Gerald Henderson. Yes, Miriam said. Garrett set his phone face down on the table. He pressed both hands flat against it. He took a breath. He's Dr. Jones's father-in-law, he said. The silence that followed Paul Garrett's words lasted exactly 3 seconds. Miriam counted them the way she counted everything. Automatically, involuntarily, a habit so deeply embedded that she no longer noticed she was doing it. 3 seconds of silence in which the air in the conference room seemed to thicken, and Garrett's hands pressed flatter against the face-down phone on the table, and the HR woman, whose name Miriam still did not know, made a very small sound in the back of her throat that was not quite a word. His father-in-law, Miriam repeated. Not a question. She was giving herself the 3 seconds she needed to absorb it, to file it in the correct place, to understand what it changed and, more importantly, what it did not change. Margaret Henderson is Dr. Jones's wife, Garrett said. He was still looking at the table. Gerald Henderson is her father. Jones admitted him last night personally. He was the attending of record on the case from the beginning. He paused. He was the attending who dismissed your concerns this morning. Miriam sat very still. The HR woman, whose badge read Karen Lyle, Risk Management, had stopped writing. Her pen was suspended above her notepad in a way that suggested her hand had simply forgotten what it was doing. Does Dr. Jones know, Miriam said carefully, that his father-in-law is currently in the cardiac cath lab? He was notified 11 minutes ago, Garrett said. He finally looked up from the table. His face had the particular exhausted quality of a man who has just understood the full depth of the problem he is standing in. He left the department immediately. Miriam thought about that. She thought about Harrison Jones receiving that call. Wherever he had gone after disappearing from the corridor, wherever he had retreated to construct his version of the afternoon's events. She thought about what it would feel like to be that man in that moment. The arrogance, the rage, the entitlement, all of it suddenly irrelevant, suddenly swept aside by something so much larger and more personal than any power struggle in a trauma bay. His wife's father, on the table, because of a decision he had made, or rather a decision he had refused to make, at 7:15 that morning when a nurse handed him a flag chart, and he had said, with complete confidence and complete indifference, that she was wrong. She thought about Gerald Henderson's hand around her wrist. I've got you. Stay with me. She thought about the color she had seen at 6 o'clock that morning, that subtle, terrible draining of warmth from a face, and the absolute certainty she had carried for 9 hours that something was wrong, and the wall she had run into, over and over, every time she tried to move that certainty through the official channels of the department's hierarchy. She didn't feel vindicated. That was the thing about being right, when being right costs this much. There was no satisfaction in it. There was only the weight of it. The plain, heavy, irreducible weight of what had almost happened. I need to go back to my patients, she said. Garrett and Lyle both looked at her. Ms. Gray, Lyle said, and her voice had shifted from its earlier, careful neutrality into something more direct. We are in the middle of a formal documentation process. The events of this afternoon. I have patients on the floor, Miriam said. I have a 9-year-old in the secondary bay waiting for a cardiologist who is not yet on site. I have 2 MCI patients who were assigned to my care during active triage. My formal statement is complete. You have everything I know. She stood up. Whatever needs to happen next can happen after my shift ends. Karen Lyle looked at Paul Garrett. Paul Garrett looked at Miriam. And then, with a small, decisive nod of a man who had just recalibrated his understanding of who, exactly, was the most competent person in this particular room, he said, "Of course." Miriam walked back to the floor. At 3:52, Callie's pediatric cardiologist, Dr. Sandra Park, arrived at the secondary bay. She was a small, efficient woman with reading glasses pushed up on her forehead and the unhurried precision of someone who had been excellent at her job for long enough that excellence had become simply the default state. She reviewed the monitor, reviewed Miriam's documentation, and looked up with an expression that was both professionally approving and mildly surprised. You caught commotio cordis in the middle of a mass casualty event, she said. Her rhythm presentation was consistent, Miriam said. Her rhythm presentation was subtle, Dr. Park said. Most people would have missed it. She paused. I mean that as a compliment. I know, Miriam said. Dr. Park looked at her for a moment. A real look, the kind that takes in more than the clinical surface of a person. Then she turned back to Callie and introduced herself with a warmth that was entirely genuine and entirely practiced at the same time. the particular combination that only good pediatric physicians achieve. And Miriam stepped back and let her work. The MCI floor was decompressing. The acute wave had crested and was receding. Critical patients stabilized or transferred to surgical suites. Moderate cases moved to observation. Walking wounded triaged to the waiting area, where social work and patient advocates were managing the particular human wreckage that follows mass trauma. The floor had the feel of a room after a storm has passed. Not calm, not quiet, but changed. Charged with the particular kind of exhaustion that follows extended crisis, the kind that lives in the body before it reaches the mind. Miriam moved through it, completing her documentation, checking her remaining patients, performing the quiet, administrative work of ending a crisis properly. Because ending it properly mattered. Because the paperwork and the sign-offs and the careful, complete transfer of information between shifts was not bureaucracy, it was safety, and she had never once in her career treated it as anything less. It was during this, at 4:19, at the documentation station near the east wall, that she became aware of a particular quality of stillness in the corridor outside the bay entrance. Not the ordinary stillness of a busy floor momentarily between crises. Something different, more charged. She looked up. Dr. Harrison Jones was standing in the doorway. He was not in his white coat. This was the first thing she registered, and it struck her as oddly significant. The coat that was so much a part of his public architecture, the embroidered name, the pressed lapels, was gone. He was in his scrubs and his shirt, and he looked, without the coat, considerably less like the version of himself he presented to the department every day. He looked like a man. Just a man who had been crying, though he would probably deny it, whose eyes were reddened around the edges and whose jaw was set with the particular tightness of someone holding their face together through effort of will. He was looking at Miriam. The floor noticed him. The awareness of his presence moved through the room the way awareness always moves through a room where something significant has happened. In glances, in slight pauses, in bodies that adjusted their orientation without announcing why. Deborah Wills, at the charge station, looked up. Dr. Reyes, finishing a note at the far end of the floor, looked up. 3 nurses at the medication cart looked up. Nobody moved toward Jones. Nobody moved away. They waited. Miriam finished the line she was typing. She saved the document. She turned around. Jones crossed the floor toward her. His pace was different from his usual pace. No sweep, no command, just a man walking towards something he was not certain he deserved to reach. He stopped 6 feet from her, which was also different. He was a man who had always used physical proximity as a form of authority, who stood close to people to make them feel the weight of his presence. 6 feet was a distance that said something. "Mr. Henderson," he said. His voice was rough at the edges. They got to him in time. They're saying, the cardiologist is saying that if he'd gone another 2 hours without intervention. He stopped, swallowed, started again. They're saying he would have died. Miriam said nothing. "I need you to know," Jones said, "that I am aware of what I did this morning, of the decision I made at rounds." His jaw tightened further. "And I am aware of what I did this afternoon." The floor was listening. Every person on it. They were not pretending not to. The pretense had expired somewhere around the moment Jones walked through the door without his coat. "Dr. Jones," Miriam said. Her voice was level. Not warm, not cold, not forgiving, not condemning. Level. The voice of someone who was going to say what was true, regardless of what response it produced. "I documented my concerns at 6 o'clock this morning. I flagged the chart at 6:45. I communicated directly to you at 7:15. Every observation I made, every clinical concern I raised, is in the patient record with timestamps. That documentation saved Mr. Henderson's life, not because I put it there, but because the cardiology team on call was able to act on it when the STEMI presented." She paused. "I did my job. That's all I did. Jones absorbed this. She watched him absorb it. Watched the way her words moved through him, not as an attack that he needed to deflect, but as a simple accounting that he had to stand inside and feel the full dimensions of. "He's my wife's father," Jones said. His voice cracked very slightly on the last word. "Margaret is... she's with him now. She doesn't know yet about this morning, about what I..." He stopped. "She's going to find out." "Yes," Miriam said, "she is." The bluntness of it landed. He blinked. It was not the response he had been preparing for. Not absolution, not cruelty, but the plain acknowledgement that the consequences he had set in motion were real and would continue to be real, and that there was no version of this conversation that changed that. "I grabbed you," Jones said, and saying it out loud in the middle of the floor, with everyone hearing, seemed to cost him something significant. His voice had dropped, but it was still audible. Deliberately, Miriam thought. Deliberately, not whispered. "I grabbed you in front of this entire staff while you were caring for a patient. And before that, I dismissed your clinical judgment because..." He paused for a long time. "Because you were a nurse. Because you were quiet. Because I had decided, a long time before this morning, that the people who looked like you and worked in the role you work in were not people I needed to listen to." The floor was so quiet that Miriam could hear, from somewhere beyond the bay doors, the faint sound of a monitor alarm being silenced by someone at a station down the corridor. She could hear Deborah Wills exhale slowly, deliberately, at the charge desk. She could hear the particular texture of 30 people processing something that was real. "I'm sorry," Jones said. "I know that's insufficient. I know saying it doesn't..." He stopped again, and this time the stoppage was not rhetorical. He was genuinely stuck. Genuinely out of the language he had always been able to produce on demand. The polished, managed language of a man who had navigated every professional difficulty of his career with words. Those words were gone now. What was left was just the man. Standing in the middle of the floor he had commanded for 7 years, without his coat, without his certainty, apologizing to a woman he had never, not once in 3 years, actually seen. Miriam looked at him for a long moment. "Go be with your wife," she said. He blinked. Whatever he had expected, whatever he had been braced to receive, it was not that. "Mr. Henderson needs his family right now," Miriam said, "and your wife needs you. Whatever happens next with the formal process, whatever HR and risk management and the board decide, that's for tomorrow. Right now, tonight, Gerald Henderson is alive, and he is going to need to see that his son-in-law is the man he should be." She paused. "Go be that man." Jones looked at her with the expression of someone who has just been handed something they don't quite know how to carry. It was not a comfortable expression. It was not a resolved one. It was the expression of a man at the beginning of a very long road who has just for the first time understood how long the road is. He nodded once, and he left. The floor resumed breathing. Deborah Wills stood up from the charge desk, walked to where Miriam was standing, and stopped beside her. She didn't say anything for a moment. She just stood there, shoulder to shoulder, the way people stand when they have been through something together, and the words for it haven't quite arrived yet. "You know they're going to try to manage this," Deborah said finally, quietly, not speculating, stating. The voice of a woman who had worked in institutions long enough to understand how institutions respond to their own emergencies. "Administration, legal. Jones has 30 years at this hospital and 4 named endowments and a wing that bears the department's funding history. They're going to want to find the version of today that costs them the least." "I know," Miriam said. "You have documentation," Deborah said. "I have documentation. You have 30 witnesses." "I know." Deborah was quiet for another moment. Then, "Who are you, Miriam?" She said it simply, without drama. A genuine question from a woman who had worked beside this person for 3 years and was only now understanding how little of her she had actually seen. I have worked trauma for 22 years. I have never seen anyone move the way you move today. I have never seen anyone stay that calm when—" She stopped, chose different words. "Where did you come from?" Miriam considered the question, not the specific geography of it, where she had been born, where she had trained, what her CV said at the top of the page. The real question underneath it. The question about who she was and how she had become that person and what it had cost. "Somewhere that made today look manageable," she said. Deborah looked at her for a long moment. Then she nodded. The nod of a woman who understood that some answers were complete even when they didn't explain everything. "Okay," she said, and she went back to the charge desk. At 4:47, Miriam's phone buzzed. She looked at the screen. It was an internal message from the cardiac ICU, 2 floors up. The message was from a nurse named Torres, who Miriam knew from occasional cross-department encounters. Competent, straightforward, the kind of colleague you could trust to say what was accurate. The message read, "Your patient Henderson asking for you. Says he wants to thank the nurse who saved his life. Says he knows your name." Miriam stared at the message for a moment. Then she typed back, "Tell him I'll come up when my shift ends." Torres responded within 30 seconds. "He says he'll be awake. He says to tell you he still thinks hospital food is terrible." Miriam felt something move through her chest that was not quite a smile and not quite tears, but lived in the same neighborhood as both. She put her phone in her pocket and went back to work. The next hour was the administrative hour, the shift transition, the handoff documentation, the careful, complete transfer of every patient status to the incoming team. Miriam gave each handoff with the same precision she brought to everything, leaving nothing assumed, nothing vague, nothing that could become a gap in care during the hours she would not be on the floor. She had done this hundreds of times. She did it now the same way she had always done it, with the same attention, the same clarity, the same fundamental refusal to treat the end of her shift as the point at which her responsibility ended. It was during the final handoff, at 5:58, that Dr. Reyes caught up with her. He was 29 years old, in his second year of residency, and he had the particular quality that the best young physicians had, an awareness of what he didn't know that was larger and more honest than his awareness of what he did. He had been on the floor since 7 that morning. He had seen everything. "Ms. Gray," he said. He was holding his tablet against his chest like a shield he'd forgotten he was carrying. "I just need to say—" He stopped, tried again. "I saw what happened this afternoon, the whole thing, and I didn't—" His jaw tightened. "I didn't say anything. When Dr. Jones grabbed you, I was standing right there and I didn't say a single word." Miriam looked at him. "I've been thinking about that for the last 3 hours," he said, "and I don't have an excuse. I froze. I let the hierarchy—" He shook his head. "That was wrong. You were my colleague, and you were being assaulted, and I stood there." "You were a second-year resident in a room with your department chief," Miriam said. "That's not an excuse." "No," she agreed. "It's not, but it is an explanation." She looked at him steadily. "The question is what you do the next time." He met her eyes. "There won't be a next time. Not like that. Not from me." She studied him the way she studied everything, thoroughly, without hurry, reading the layers beneath the surface. He meant it, not with the temporary conviction of someone who had been moved by a dramatic moment and would find their behavior unchanged when the drama faded, but with the deeper, more uncomfortable conviction of someone who had looked at themselves clearly and did not like what they had seen. Those were different things. She had learned, a long time ago, to tell them apart. "Good," she said, and she meant it. She signed off her last chart at 6:04, exactly 12 hours after she had clocked in. She stood at the station for a moment, her hand flat on the counter, and she let herself feel the full weight of the day. The 12 hours, the decisions, the mass casualty, the confrontation, the formal statement, the conversation with Jones on the floor, the 9-year-old with the steady rhythm, and the evaluating eyes. All of it settling into her body the way weight settles after you've been carrying it for too long. Not pain exactly, but presence. The physical fact of a day that had asked everything of her and received it. Then she picked up her bag, told Deborah she was heading up to the cardiac ICU, and walked to the elevator. The cardiac ICU was a different world from the trauma bay. Quieter, more measured, the particular hush of a unit where the crises were slower and the recoveries longer, and the stakes of both were equally absolute. Miriam had been up here before, following up on patients she'd stabilized downstairs, and she always felt the shift in atmosphere the moment the elevator doors open. The urgency was still there, but it was a different frequency, lower, more sustained. Gerald Henderson was in room 7. She could see him through the glass before she reached the door, lying slightly elevated in the bed, the telemetry leads visible at the neck of his gown, his face still too pale, but carrying in it now a warmth that had not been there at 9:15 that morning when she'd pulled back the curtain and found him gray. He was alive, fully, actually alive, in the particular way that people are alive when they have come close enough to the alternative to understand the difference. He saw her before she reached the door. His face changed immediately, not dramatically, not with performance, but with the simple, immediate recognition of a man who knows exactly which face he has been waiting to see. She pushed the door open. "There she is," he said. His voice was tired but present. "I was starting to think they made you up. How are you feeling?" she asked. She pulled the chair to the side of his bed and sat, because sitting was what you did when you were not there in a clinical capacity, when you were there as a person, and that distinction mattered. "Like my heart tried to quit and someone talked it out of it," he said. He looked at her. "Was that you?" "That was the cardiology team," Miriam said. "I just made sure they had the information they needed." He was quiet for a moment. His hand moved on the blanket, that same motion she had noticed that morning, the slight curl of his fingers, but slower now, restful. "They told me," he said, "the nurses up here told me what the records showed, that you flagged my chart at 6 in the morning, that you documented every change, that you—" He stopped, his jaw worked. "That the doctor on my case dismissed your concerns." Miriam said nothing. "That doctor," Henderson said carefully, "is my son-in-law." "I know," Miriam said. He absorbed that. "How long have you known?" "Since this afternoon." He was quiet for a long time. Outside the room, the ICU moved through its evening rhythms. The medication rounds, the vital checks, the quiet, efficient work of keeping people alive through the night. A monitor somewhere beeped twice and was silenced. "Harrison is—" Henderson started, stopped, started again. "He's not a bad man. I want you to know that. He's a difficult man. He's been difficult since the day Margaret brought him home, and I have never in 28 years managed to get a read on whether the arrogance is armor or whether it just goes all the way through." He paused. "Today may have answered that question." "That's for you and your family," Miriam said, "not for me." He looked at her sharply, not offended, assessing. The look of a man who had spent 40 years in a classroom learning to tell the difference between deflection and genuine wisdom. "You're not angry," he said. Not a statement, a question in the form of one. "I'm a lot of things," Miriam said. "Angry is in there, but it's not the loudest one right now." "What's the loudest one?" She thought about it. Honestly, the way she always thought about questions that deserved honest answers. "Tired," she said, "and glad you're here." Gerald Henderson looked at her for a long moment. Then he reached out his hand, the same hand that had closed around her wrist that morning in Bay 4. The same grip she had felt change from weak to stronger as the intervention began to work. And he held it out, open, palm up, not asking her to take it, offering. She put her hand in his. "Thank you," he said, "for seeing me when nobody else did." And Miriam Gray, who had spent 3 years being invisible in these halls, who had spent 8 years before that learning to survive in places that made invisibility a precondition of survival, who had built her life on the careful, deliberate practice of being overlooked, sat in a chair in the cardiac ICU and held the hand of the man she had saved, and did not say anything at all, because there was nothing to say that the silence did not already contain. She stayed for 11 minutes. Then she squeezed his hand once, stood up, said goodnight, and walked to the elevator. The doors opened. She stepped in, and as they closed, she caught, reflected in the polished metal surface of the elevator door, a brief, imperfect image of herself, tired, still in her scrubs, her hair no longer entirely where she'd put it that morning, looking, for the first time in a very long time, like someone who had been seen. The elevator descended, the floor numbers dropped, and somewhere in the hospital above her, in room 7 of the cardiac ICU, Gerald Henderson's heart beat on, steady, persistent, stubbornly, beautifully continuing, because 12 hours ago, a quiet woman with careful eyes had stood at the foot of his bed and refused to look away. The elevator reached the ground floor at 6:21 in the evening, and Miriam stepped out into the main corridor of Metropolitan Mercy with a particular kind of emptiness that follows a day that has taken everything you had. Not a bad emptiness, not the hollow kind, the kind that comes after something real, after you have been fully used in the way you were built to be used, and the using has left you clean. She was heading for the staff exit when her phone buzzed again. She looked at the screen, expecting Torres from the ICU, expecting Deborah with a shift question, expecting any of the dozen ordinary follow-up communications that trailed the end of a complicated shift, like a wake trailing a boat. It was not any of those things. The number on the screen was one she did not recognize, a local area code, 7 digits she had never seen. She almost let it go to voicemail. She was 12 hours in and her feet were complaining, and the elevator ride had used the last of whatever reserve she'd been operating on for the past 4 hours. She almost put the phone back in her pocket. She answered it. "Is this Miriam Gray?" The voice on the other end was a woman's voice, controlled in the way that voices are controlled when the person using them has been crying recently and has made a decision to stop. Precise, carrying beneath the precision a weight that Miriam recognized the way she recognized most things, instantly, completely, from the inside out. "This is Miriam," she said. A pause, brief, the kind of pause that contains a breath being taken and released before the next sentence. "My name is Margaret Jones," the voice said. "I'm calling from the cardiac ICU. My father told me I should call you." Another pause, longer this time. "I've been sitting with him for the last 2 hours, and he keeps asking if I've called you yet. And I needed to understand what happened today before I could." She stopped, started again. "I'm sorry, I'm not doing this well." "You're doing fine," Miriam said. She had stopped walking. She was standing in the main corridor of the hospital, people moving around her in the stream of the evening shift change, and she was completely still. "Take your time." "My husband told me," Margaret said. "He came to the ICU about an hour ago, and he sat down and he told me everything. About this morning, about the chart, about—" her voice contracted around something. "About what he did to you in the trauma bay." A sound, very brief, that was not quite a word. "I need you to know that I am so deeply ashamed of what he did. And I need you to know that I understand. I understand that my shame doesn't change what happened. And it doesn't." "Mrs. Jones," Miriam said. Margaret stopped. "Your father is alive," Miriam said. She said it plainly, the way she said everything that was true and needed to be said without decoration. "He is in that room upstairs right now with a heart that is beating because the right interventions happened at the right time. That is what matters tonight." The silence on the other end was different from the silences before it. Fuller, more complex. The silence of a woman absorbing something she had needed to hear said in exactly that way, and who was, in the moment of hearing it, not quite able to speak. "My father said you held his hand," Margaret said finally. Her voice was very quiet. "Yes," Miriam said. He said, he said you talked to him like he was a person, like he was the most important person in the room." A breath. "He said he could tell you were scared for him. Not clinically scared, actually scared, like someone who cared." Miriam stood in the corridor and did not say anything for a moment. She was thinking about 6 o'clock that morning, about the color she had seen, about the things she had felt when she looked at Gerald Henderson's face, and understood, in the specific, irreducible language of her training and her experience in her gut, that something was ending for him unless someone stopped it. She was thinking about whether what she had felt was caring or competence, and arriving, as she always arrived at that question, at the conclusion that in her particular case the two things were the same thing, had always been the same thing, were in fact not separable at all. "Your father was easy to care about," she said. It was the truth, simple and complete. Margaret made a sound that was, Miriam was almost certain, a laugh attempting to coexist with a sob. "He is," she said. "He really, really is." Then, "Can I ask you something?" "Yes." "Are you going to—" "The formal process, the documentation. Harrison said there's already an HR investigation." Her voice was careful now, picking its way through the words. "He said you have witnesses. He said you have the patient records." She paused. "He said he deserves whatever happens." Miriam was quiet for a moment. She thought about Paul Garrett and Karen Lyle in the conference room. She thought about the 30 witnesses on the floor. She thought about the timestamps, 600, 6:45, 7:15, 2:59, each one a small, irrefutable monument to the sequence of events that had led here. She thought about Deborah's words. "They're going to want to find the version of today that cost them the least." "The process will go where it goes," Miriam said. "I told the truth to risk management and HR. Every piece of documentation I created today is in the record. What the institution decides to do with that is not something I control." She paused. "But I want you to understand something, Mrs. Jones. What I did today, what I did from 6 o'clock this morning through the end of my shift, I would do exactly the same way again. Not to prove a point, not to fight your husband, because a 67-year-old man was my patient and his life was my responsibility, and I take that responsibility seriously." She let that land for a moment. That's all this ever was. Margaret Jones was quiet for so long that Miriam checked the screen to confirm the call was still connected. "Harrison has never been," Margaret started, stopped, chose different words. "He is a brilliant physician. I have watched him save lives in ways that are genuinely extraordinary. And he has also, for as long as I have known him, been someone who could not see the people around him. Could not or would not." Her voice was tired in the specific way that long, complicated love makes people tired. "I don't know which one it was. I've spent 24 years not knowing." "That question," Miriam said carefully, "belongs to your marriage, not to me." "I know," Margaret said. "I know. I want you to know that what happened today is not, that I have never accepted that behavior, that I have argued with him about his conduct with staff more times than I can count, and that arguing wasn't enough, that my discomfort with how he treated people wasn't enough to change it." A pause. Today was enough. Miriam heard something in those 3 words that was larger than their surface. Today was enough. Not the assault alone, not the professional failure alone, but the combination, the full, complete, simultaneous revelation of what her husband was capable of in a single afternoon, laid out across a trauma bay and a cardiac cath lab and an ICU room in a sequence so clear it was impossible to look away from. "Mrs. Jones," Miriam said, "go be with your father tonight." A silence. Then, Thank you, Miss Gray, for everything you did today. For just thank you. The call ended. Miriam stood in the corridor for a moment longer, the phone in her hand, the hospital moving around her in its perpetual churn of urgency and ordinary human need. Then she put the phone in her pocket and walked to the staff exit. The night air outside the hospital was cool and carried the particular smell of a city evening. Exhaust and food from somewhere down the block, and the faint green undertone that cities have in spring when the trees have decided, against all urban logic, to bloom anyway. She stood at the top of the steps for a moment and breathed it. She was still standing there when she heard the door behind her open. She turned. It was Deborah Wills, coat on, bag over one shoulder, looking like a woman who had also given everything she had to the last 12 hours, and was now like Miriam, standing at the boundary of the hospital and the rest of the world and taking a breath before crossing it. They stood there for a moment, side by side at the top of the steps, not saying anything. The city moved in front of them. A cab honked somewhere. A couple walked past on the sidewalk, close together, oblivious. HR called me, Deborah said, about an hour ago. Karen Lyle. She wanted a statement from the charge nurse. She paused. I gave her one. What did you tell her? Everything, Deborah said. Every single thing I saw, from the moment Dr. Jones picked up your chart this morning to the moment he walked off the floor this afternoon. She paused. I also told her something she didn't ask for. What's that? That you are the best trauma nurse I have seen in 22 years of trauma nursing. Deborah said it flatly, with the particular matter-of-fact quality of a woman who states what is true without requiring it to be received as a compliment. Not the most credentialed, not the highest ranked, the best, the most skilled, the most instinctive, the most right. She looked at Miriam. I told her that Metropolitan Mercy has had that nurse on their staff for 3 years and has spent 3 years treating her like furniture. Miriam absorbed this. It went through her in a way she hadn't entirely expected. Not the professional assessment, which she received the way she received most assessments, factually, filing it where it belonged, but the other part, the furniture part, the plain, direct acknowledgement from a colleague she respected, a woman who had seen more than most, that the invisibility had been real, that it had not been in Miriam's imagination, that other people had seen it happening and were now, in the aftermath of everything, willing to name it. Thank you, Miriam said. Don't thank me, Deborah said. I should have said it 3 years ago. She adjusted her bag on her shoulder. I should have said it the first week you came to this floor, and I watched you catch something in a patient presentation that the attending missed. I should have said it every single time I watched you be talked over and dismissed and walked past, which is more times than I should have let happen without saying something. She paused. That's on me, and I'm telling you it's on me, directly, because I think you deserve to hear that from someone who actually saw it. Miriam looked at her. She thought about everything she might say. She thought about the particular complexity of accepting an acknowledgement like that, not deflecting it, not diminishing it, but also not allowing it to become something larger than it was. Just receiving it, letting it be what it was. I appreciate that, she said. I genuinely do. Deborah nodded. And then, because Deborah Wills was a woman who had always known when a moment was complete and when to move through it without overstaying. You walking to the lot? No, Miriam said. I take the bus. Of course you do, Deborah said, and something in her voice was warm and dry and precisely right. She went down the steps. At the bottom, she looked back up. Miriam, whatever they try to do with this, the administration, legal, whoever, don't let them quietly it. You hear me? I hear you, Miriam said. Deborah walked to the parking lot. Miriam watched her go. She took the bus home. It took 23 minutes. She sat in the third row by the window and watched the city go by, the lit windows, the people on the sidewalks, the unremarkable evidence of ordinary life continuing at its ordinary pace, indifferent to everything that had happened inside Metropolitan Mercy Hospital between 6 o'clock that morning and 6:21 that evening. She got off at her stop, walked the 4 blocks to her apartment, unlocked the door. Inside, the apartment was exactly as she had left it, small, orderly, containing the precise minimum of things necessary for a life. She had lived like this for a long time, not from poverty, but from habit, from a version of herself that had learned, in other contexts, to keep her footprint light, to be prepared to move, to carry nothing that could not be carried. She put her bag down. She sat on the edge of her bed, and for the first time all day, the first genuine, unguarded moment she had allowed herself since she had clocked in at 600, she let the day reach her. Not dramatically. She was not a person who fell apart dramatically, but she sat on the edge of her bed in her apartment in the city, and she let herself feel the full sequence of the last 12 hours. The color of Gerald Henderson's face at 6 o'clock, the flag on the chart, the dismissal at rounds, the STEMI, the mass casualty event, the hand in her hair, the wrist, the HR statement, Callie's rhythm steadying on the monitor, Jones standing in the middle of the floor without his coat, room 7 in the cardiac ICU, Margaret Jones's voice on the phone. All of it, the full weight of it, received into her body without resistance. It lasted about 4 minutes. Then she stood up, went to the kitchen, made tea, and sat at her table. At 8:53, her phone buzzed with a text from a number saved under a first name only. Joel. She had 3 contacts in her phone saved by first name only. They were all people she had known before Metropolitan Mercy Hospital, before nursing school, before the version of herself she had built on top of the one that existed before. Joel was the only one of the 3 who still reached out with any regularity, and his messages were always short, always direct, always arriving with the particular timing that suggested he had some mechanism she had never fully identified for knowing when to check in. The text read, "Rough day?" She looked at it for a moment. Then she typed back, "Manageable." 3 dots appeared, disappeared, appeared again. Then, "You sure?" She considered the question with the same honesty she brought to everything. The assault, the 12 hours, the formal statement, Gerald Henderson's hand, Callie's eyes, Jones without his coat, Margaret Jones's voice saying today was enough. She typed, "I'm sure. Go to sleep, Joel." A pause, then a single response. "Good work today, Gray," whatever it was. She put the phone down, drank her tea, went to bed. She was asleep by 9:40. She slept without dreaming, the deep, clean sleep of a body that has been fully used and fully emptied and needs nothing now except rest. At 7:14 the next morning, she walked back through the doors of Metropolitan Mercy Hospital. The night shift was finishing its handoff. The day team was arriving. The trauma bay was in its early morning configuration, quieter than it would be in 2 hours, already building toward the day. The fluorescent lights hummed. The monitors beeped. The smell of the department, antiseptic and coffee, and the particular human smell of a place where people came in their most compromised states and were met by people who had chosen, deliberately, to be there, settled around her like something familiar. She was at the documentation station, pulling her first patient assignment, when she became aware that the department was behaving differently. Not dramatically, not with announcement, but differently. People were looking at her, not the peripheral, invisible-making non-look that she had navigated for 3 years in these halls. Not the smooth, practiced social blindness of a department that had learned to move around her without acknowledging her, but actually looking. The kind of looking that registers a person, that says, "I see you. I know you're there. I understand now who you are." Dr. Reyes passed the station on his way to his first case of the morning and made eye contact with her and said, "Good morning, Ms. Gray," with the particular directness of a man who had made himself a promise the previous afternoon and was beginning the work of keeping it. One of the night nurses, finishing her final chart before leaving, paused at the station and said quietly, "We heard what happened, all of it, and for what it's worth," she stopped, adjusted. "You did right, every bit of it." Miriam said thank you. She meant it. The morning shift charge was a man named Thomas Bridges, covering for Deborah's off day, and he came to her station at 7:22 with a printout in his hand and an expression that was carefully composed over something that was not quite as composed. "Administration sent a communication this morning," he said, putting the printout on the station in front of her. "Addressed to the department." He paused. "I thought you should know before rounds." She read it. It was a formal communication from the Office of the Chief Medical Officer, addressed to all staff of the trauma department. It acknowledged that an incident had occurred during the previous day's shift. It stated that a full investigation was underway in accordance with hospital policy. It stated that the hospital took the physical and professional safety of all staff members as a matter of the highest institutional priority. It stated that pending the conclusion of the investigation, Dr. Harrison Jones had voluntarily stepped back from his clinical duties as chief of trauma. Voluntarily. She noted that word. The administration had chosen that word carefully, and the carefulness of its choosing told her everything she needed to know about the conversations that had happened, at levels above Paul Garrett, in the 17 hours since she had left the building. She set the printout down. She looked at Thomas Bridges. "Who's covering the department?" she asked. "Dr. Chen from surgical trauma is stepping in as interim chief," he said. "She started at 6 this morning." He paused. "She asked about you, actually, specifically, said she'd read the incident report and the patient documentation, and she wanted to meet the nurse who'd flagged the Henderson case." Miriam considered this. Dr. Linda Chen was a name she knew by reputation, a trauma surgeon with significant administrative experience, known for a management style that was, by all accounts, almost diametrically different from Jones's. Competent, direct, ego-light, the kind of physician who asked nurses questions and then actually listened to the answers. "I'll introduce myself after rounds," Miriam said. "She'll appreciate that," Thomas said. He picked up the printout, then set it back down, then looked at her with the specific expression of a person who has something more to say and is deciding whether to say it. "There's one more thing." She waited. "The Henderson family," he said. "Margaret Jones called the CMO's office this morning, before 7. She gave a formal statement, not about the assault, HR already has that, but about the clinical events, about the chart flag, about the dismissal at rounds, about the documentation trail." He paused. She used the phrase institutional failure to act on competent clinical judgment, and she asked for a review of the department's consultation escalation protocols. Miriam absorbed this. Margaret Jones, in the hours after sitting at her father's bedside in the cardiac ICU, had made a call to the chief medical officer, not to protect her husband, not to manage the institutional narrative, to add her voice to the record, to say, with the particular authority of a family member whose father's life had hung on the question, "This happened, and it should not happen again." She sat with that for a moment. She thought about the woman on the phone, controlled, tired, carrying the weight of a complicated marriage and a father who had almost died. And she felt something toward her that was not quite admiration and not quite kinship, but was in the territory of both. "Thank you for telling me," Miriam said. Thomas Bridges nodded. He walked back toward the charge desk, and Miriam Gray turned back to her patient assignments and began her day. At 8:03, she was in Bay 2 with a 61-year-old woman named Eleanor Tran, who had come in with shortness of breath and was watching Miriam with the particular watchful attention of a patient who has heard, through the mysterious and highly efficient communication network that exists among hospital patients, that the nurse taking care of her is someone worth paying attention to. "You're the one from yesterday," Eleanor said. It wasn't quite a question. I was here yesterday, yes, Miriam said, checking her IV line. My daughter works in radiology, Eleanor said. She texted me last night, said the whole hospital was talking about you. A pause while Miriam checked her oxygen saturation. She said a doctor grabbed you and you put him on the floor. Miriam looked up from the oximeter. I redirected a situation that needed redirecting, she said. Eleanor Tran looked at her with the frank, unfiltered assessment of a woman in her 60s who had not survived to her 60s by accepting imprecise answers. That's a very careful way of saying it, she said. It's an accurate way of saying it, Miriam said. Eleanor studied her for another moment. Then something shifted in her face, softened in the specific way that faces soften when the person wearing them has decided to stop performing and say the real thing. Good, she said simply. Good for you. Miriam checked her temperature, documented the reading, and moved to the next item on the assessment. And in the particular quiet of Bay 2 at 8:03 in the morning, with the monitors doing their steady work, and the department building toward the day around them, she felt something she had been carrying since 6 o'clock the previous morning. That specific, sustained tension of a person waiting for the next thing to go wrong, waiting for the next wall to appear, waiting for the moment when the hierarchy reasserted itself, and the chart flag was dismissed, and the expertise was talked over, and the furniture was asked to keep quiet. She felt that thing, very slightly, begin to release. Not gone, not resolved. The formal process was still running. The investigation was open. The institution was doing what institutions do, which was manage. And managing was not the same as changing. And Miriam Gray had been in enough institutions to understand the distance between those two things. But something had shifted. In the room, in the department, in the specific geometry of who was seen and who was not, who was heard and who was not, who existed in these halls as a person and who existed as furniture. Something had shifted. And it had shifted because of the simple, cumulative, irrefutable weight of doing her job. Doing it completely, doing it honestly, documenting every decision, trusting what she knew, refusing to be talked out of what her training and her experience and her gut told her was true. And then, when a man who had never been made to doubt himself put his hand in her hair and waited for her to break, not breaking, just not breaking. That was all she had done. She had not been a hero. She had not performed courage. She had simply been, at every moment of the previous 12 hours, exactly what she was, a person with irreplaceable skills and irreplaceable knowledge, and an absolute, quiet, unbudgeable conviction that the person in her care mattered more than any hierarchy that stood between them and the help they needed. She had been that, completely, and it turned out that being that, completely, was enough to change a room, maybe even enough to change a hospital. At 8:47, Thomas Bridges came over the intercom. Gray, you have a call holding at the station. Line 3. Says it's personal. She finished her current documentation, walked to the station, picked up the phone. This is Miriam. The voice on the other end was not one she expected. Ms. Gray, the voice said, my name is Robert Calloway. I'm the director of nursing practice for the Mid-Atlantic Regional Health Consortium. A pause. I've been reviewing the incident documentation from Metropolitan Mercy Hospital, and I was hoping we could talk. Miriam's hand tightened very slightly on the receiver. About what? She asked. About you, Calloway said. About your background, about your clinical record. Another pause. And about what we think a person with your particular combination of skills and judgment could do at a regional level, if she wanted to. The trauma bay worked around her. Monitors beeped. Someone called for a supply. The ordinary, relentless, necessary work of the department continued at its own pace, indifferent to the particular quality of silence that had opened up inside Miriam Gray as she stood at the nursing station with the phone against her ear and understood that the world she had been invisible in for 3 years, for 8 years before that, for longer than she cared to calculate, was, in this moment, looking directly at her. "I have patients to see this morning," she said, "but I can talk this afternoon." Robert Calloway said he would call back at 2 o'clock. Miriam said that was fine. She hung up the phone, stood at the station for exactly 4 seconds, and then went back to her patients. This was the thing about Miriam Gray that the people who knew her only from yesterday, from the incident report, from the whispered conversations moving through the hospital like weather, did not yet understand. The call from the regional consortium director, the investigation, the voluntary stepping back of Dr. Harrison Jones, the communication from the CMO's office. None of it changed what she was doing at 8:48 on a Tuesday morning. She was a trauma nurse. She had patients. She went back to her patients. Eleanor Tran was discharged to observation at 9:15, squeezing Miriam's hand at the bay curtain with the firm, particular grip of a woman who wanted to make sure the gratitude landed. "You take care of yourself," she said, not as a pleasantry, as a directive. The kind that older women issue when they have seen enough of the world to know that the people who spend their lives taking care of others are often the last ones to extend that courtesy to themselves. "I will," Miriam said. Eleanor gave her the look that said she wasn't entirely convinced, and left. The morning moved. Cases arrived and were managed and moved on. The trauma bay found the rhythm of an ordinary day. No mass casualty, no MCI protocol, just the steady, unremarkable, absolutely essential work of a level 1 trauma center, receiving the ordinary emergencies of ordinary human life. Miriam worked through all of it with the same attention she always brought, checking, assessing, documenting, communicating, being what she was. At 10:04, she was at the medication station when she heard footsteps behind her that she recognized before she turned. Not from their sound exactly, but from their quality. A pace that was careful in a new way, deliberate without the old authority behind it. The footsteps of a person navigating a space they were no longer certain belonged to them. She turned. Dr. Harrison Jones was in the doorway of the trauma bay, not entering. Standing at the threshold, which was in itself a kind of statement, because Harrison Jones had never, in 7 years, stood at the threshold of anything. He had always entered. He had always moved through spaces as though they had been created to receive him. He was in street clothes, no scrubs, no white coat, a dark jacket, an open collar. He looked like a different man than the one who had stood in the middle of the floor the previous afternoon without his coat. That man had still carried the residue of the physician, the authority stripped down but still structurally present. This man looked like someone who had slept badly and woken to a version of himself he was still working out how to wear. He was not alone. Beside him, her hand in the crook of his arm, was a woman Miriam had not met but recognized immediately from Gerald Henderson's eyes, which were her eyes exactly, the same steady assessment, the same quiet attention. Margaret Jones was in her 40s, dark-haired, with the composed but transparently exhausted look of a woman who had been at a hospital bedside through the night and was still carrying the weight of what she had found there. She was looking at Miriam with an expression so direct and so uncomplicated in its meaning that Miriam felt it go straight through whatever professional distance she was maintaining and land somewhere much closer. It was Jones who spoke first. "I know I shouldn't be here," he said. "I'm not. This isn't about the investigation. I'm not here about that." He stopped, looked at his wife, who gave him nothing back except her presence, which seemed to be exactly what he needed. "We came to say something, both of us, in person, because I thought you deserved to hear it from me standing in front of you, not through a process." The bay was not empty. Thomas Bridges was at the charge desk. 2 residents were at the documentation station. A technician was restocking the supply cart at the east wall. Everyone had gone carefully still in the way that people go still when they understand, without being told, that something significant is happening close to them. Miriam set down the medication she was preparing. She turned fully toward them and waited. "I spent last night," Jones said, "sitting outside my father-in-law's room, thinking about the kind of physician I became, and the kind of person." He said it without the careful management she had heard in his voice the previous afternoon. Not performed humility, not the vocabulary of a man who had decided what he needed to say and was executing it. Just the plain, rough-edged truth of someone who had been sitting with something painful for enough hours that the pretense had worn away. "I became someone who looked at a quiet, competent woman who was trying to keep a patient alive and decided she didn't matter. And I have been that person for a long time, much longer than yesterday." Miriam said nothing. She was listening the way she listened to patients when they were telling her the thing underneath the thing, not preparing her response, not evaluating, just receiving. "I want you to know," Margaret said. Her voice was quieter than it had been on the phone, more tired, but absolutely clear, "that what he did to you was not a moment. It was not stress in a difficult day. It was the product of behavior I watched him bring into that hospital for years, and that I spoke to him about for years, and that I failed to escalate beyond our own walls." She held Miriam's gaze without flinching. "I am sorry for my part in that, specifically, not generally." The medication station was completely silent. Miriam looked at them both, the man who had grabbed her by the hair less than 24 hours ago, and the woman who had spent 24 years married to him and 2 hours the previous night on the phone with the CMO's office. She looked at them the way she looked at everything she needed to understand clearly, and she understood that what she was seeing was not a performance of accountability and not a strategy for managing consequences. It was two people at the beginning of a very long reckoning, showing up to the first morning of it. "Dr. Jones," she said, "what happened to you yesterday in that trauma bay, what you lost professionally, and what you're going to face through the investigation and the board review, that's the consequence of choices you made. And I'm not going to tell you it's all right, because it's not all right, and you know that." She paused. "But your father-in-law is alive this morning. He ate breakfast. The ICU nurse who texted me at 7 said he told another hospital food joke." She let that land for a moment. "Whatever else is true about yesterday, that is also true." Jones's jaw worked. He pressed his lips together in the specific way of a man preventing something from happening in his face that he isn't ready to let happen in public. "I know," he said, rough, short, real. Margaret Jones looked at Miriam with those Henderson eyes, steady and assessing and honest, and said, "He's going to need a long time to become someone different. I don't know if he will. I don't know yet if I'll be there while he tries." She said it plainly, without drama, the statement of a woman who was telling the truth about her own life in real time, without having decided yet what that truth required of her. "But I wanted to look at you and say, thank you, and mean it fully, and let you see that I mean it." "I see it," Miriam said. And she did. They left. Jones did not look back. Margaret paused at the doorway and did, briefly, and then walked on. Miriam watched them go, and then turned back to the medication station and finished what she had been preparing before the interruption. Thomas Bridges appeared at her shoulder 30 seconds later. "You all right?" he said. "Fine," she said. And then, because it was true, and because she had been working on the practice of saying true things when they were simple, actually fine, not just saying it fine. He nodded. "Okay," he said, and went back to the charge desk. At 11:37, Dr. Linda Chen came to the floor. Miriam had been told she was interim chief. She had not been told anything else, which meant the impression she formed was built entirely from the woman herself, and the woman herself was instructive. Linda Chen was 51, compact, with close-cropped, gray-streaked hair, and the kind of economy of movement that comes from spending decades in surgical trauma, where every motion needs to justify its existence. She moved through the bay the way Miriam moved through it, which was to say, without performance, without architecture, without the deliberate occupation of space that Harrison Jones had always used to announce himself. She came directly to Miriam, no intermediary, no preamble through the charge desk or the nursing coordinator. She walked across the floor, extended her hand and said, "Dr. Linda Chen, I've been reading your documentation from yesterday morning. I want to ask you some questions about your escalation process, if you have a few minutes." Miriam shook her hand. "I have a few minutes." They stood at the documentation station, and Chen asked her questions the way good physicians ask questions, specifically with the genuine intention of understanding the answer rather than confirming a conclusion already reached. She asked about the 6 o'clock observation. She asked about the flagging process. She asked about the specific clinical indicators Miriam had noted and how she had made the judgment call to escalate. She listened without interrupting. She did not fill the pauses between Miriam's answers with her own voice. When Miriam finished, Chen was quiet for a moment. Then she said, "What you did yesterday is exactly what this department should look like. The assessment, the documentation, the persistence through a dismissal, the clear and complete patient record." She paused. "It's also exactly what this department has not looked like for a long time in terms of how it treats the people who do that work." She looked at Miriam directly. "I want to change that, and I'd like your help doing it." Miriam looked at her. "What does that mean specifically?" "It means I want to redesign the escalation protocol for nursing concerns. The current protocol requires nursing staff to route clinical concerns through the attending of record first, which creates exactly the bottleneck that almost killed Gerald Henderson yesterday." Chen's voice was even, clinical, stripped of anything that could be called emotion. But underneath it, Miriam heard the specific frequency of someone who was genuinely angry about something and had chosen to direct that anger productively. "I want a parallel pathway, one that allows a nurse with documented clinical concerns to access a second attending review without going through the primary attending. Direct escalation, protected, with no professional penalty for using it." Miriam was quiet for a moment. She was thinking about 6 o'clock. She was thinking about the flag on the chart. She was thinking about the specific, grinding quality of being competent and correct, and being made to feel the weight of the hierarchy every time she tried to move what she knew to the channels that were supposed to exist for exactly that purpose. "That protocol would have saved a lot of time yesterday morning," Miriam said. "Yes," Chen said, "it would have, and it will save lives going forward if we build it correctly." She paused. "I want someone who understands the gap from inside it, not from the attending side, from the nursing floor." "I'll help," Miriam said. Chen nodded once, the nod of a person who does not require more ceremony than that. "Good. I'll schedule time next week." She started to turn away, then stopped. "One more thing. The consortium director who called this morning, Calloway." Miriam's eyes sharpened slightly. "He called me too," Chen said, "before he called you. He was asking about your background, your clinical record, how I assessed your performance." She looked at Miriam steadily. "I told him the truth, every piece of it." A pause. "I also told him that whatever he was planning to offer you, Metropolitan Mercy was going to make a competing argument for keeping you here. Because people like you do not come along often. And when they do, the right institutional response is not to let the consortium poach them." She said it without warmth and without salesmanship, just the flat, accurate statement of a physician who assessed assets the way she assessed patients, clinically, completely, without sentimentality. "Take the call this afternoon, hear what he has to say, and then think about what you want, not what's offered, what you want." She walked away. Miriam watched her go and felt something she hadn't expected. Not the uncomplicated pleasure of being valued, which was its own thing, but something more specific. The feeling of being evaluated accurately, of having someone look at her work and see it clearly and respond to it with the same precision it had been performed with. After 3 years of furniture, it landed differently than she could have anticipated. She went back to her patients. At 2 o'clock exactly, her phone rang. Robert Calloway was punctual, which she noted and approved of. "Miss Gray," he said, "thank you for making time." "Of course," she said. She was in the break room, the door closed, the room empty except for the hum of the refrigerator and the distant muffled sounds of the floor. "What would you like to discuss?" Calloway was efficient. She appreciated that. He did not build to his point through layers of preamble. He told her directly. The consortium oversaw clinical standards for 14 hospitals in the region. They had a newly created position, Director of Clinical Nursing Practice, that had been open for 4 months without a candidate who satisfied the full range of what they needed. The position involved designing and implementing nursing practice standards across all 14 facilities, with a specific mandate to address the structural gaps between nursing clinical judgment and physician authority that led to preventable patient harm. It was not a bedside role. It was a systems role. It was, in Calloway's words, the kind of position that changes how an entire regional health system treats the nurses who actually keep patients alive. He paused when he finished. He was giving her space to respond. Miriam sat in the break room and thought about it honestly, not about the title or the salary, which he had also stated clearly and which was significantly more than she currently made, about the work itself, about the thing Chen had described 2 hours ago, the parallel escalation pathway, the protected reporting structure, the redesigned protocol, and about that being one hospital, one department, one set of 14 bays, and then about 14 hospitals. About the Henderson protocol, potentially, in 14 trauma departments. About the number of 6 o'clocks that represented. The number of charts that might get flagged and received rather than dismissed. She thought about Gerald Henderson's hand around her wrist. She thought about Callie's rhythm steadying on the monitor. She thought about the overtime years before this hospital, the other rooms. The specific training that had made her what she was in that trauma bay, and whether that training had been building towards something small in particular or towards something larger. She thought about Deborah's words at the top of the steps. "Don't let them quietly it." "Can I ask you something?" she said. "Please," Calloway said. The position, the clinical practice mandate, does it have the authority to compel protocol changes? Or does it make recommendations that individual hospital administrations can decline? A pause. The pause of a man who was deciding how honest to be, which in Miriam's experience was always the most revealing pause available. Currently, he said, it makes recommendations. The binding authority rests with individual hospital administrations. Then the first thing I would want to change, Miriam said, is the structure of the mandate. Because a nursing practice director who can be declined is a nursing practice director without practice. Silence on the line. Then, "That's a significant ask." "Yes," Miriam said, "it is." She paused. "Gerald Henderson is alive because I documented every clinical observation I made and refused to stop escalating when I was dismissed. The documentation had force because I created it methodically and completely. Recommendations without binding authority are documentation without force." She let that sit. If you want someone to change how 14 hospitals treat nursing clinical judgment, give them the structure that makes change actual. Otherwise, you're asking for a report. The silence lasted longer this time. She sat with it without filling it, which was something she had learned in a different context. That the person who fills silence loses ground, and that the willingness to let a silence extend was itself a form of communication. "I need to take that conversation to the board," Calloway said finally. "That level of structural change is above my authorization." "I understand," Miriam said. "Take it to the board. If they're serious about what they told you they wanted, they'll say yes." She paused. "And if they're not serious, then the position isn't what you described it to me as, and we'd both be wasting each other's time." Another pause, then, And this surprised her slightly. Calloway laughed. Not the polished, managed laugh of a professional conversation, but an actual, short, genuine laugh of someone who has just encountered something they didn't fully anticipate. You know, he said, the incident report from yesterday described you as a quiet and unassuming presence in the department. That's accurate, Miriam said. It really isn't, Calloway said. I'll call you when I've spoken to the board. My estimate is 48 hours. A pause. Don't make any decisions before I call back. I'll make whatever decisions need making, Miriam said, but I'll answer when you call. She hung up, sat for a moment, then stood, put her phone in her pocket, and went back to the floor. The afternoon passed. Patients came and were cared for and moved on. The department breathed through its hours. At 4:30, Dr. Reyes caught up with her during a brief lull at the documentation station and told her, unprompted, that he had spoken to 2 other residents about what had happened, and that all 3 of them had agreed to file supporting statements with HR. Beyond the required incident witness accounts, voluntary statements about the pattern of conduct they had observed from Dr. Jones over their time in the department. It's not nothing, he said. I know it's not everything, but it's what I can do. It's not nothing, Miriam agreed. At 5:15, a text from Torres in the cardiac ICU. Your patient Henderson is being moved to step down tomorrow. Doing great. He asked me to tell you he's been practicing a new hospital food joke for when you visit. She smiled, fully, without reservation, a smile nobody was there to see. At 5:59, 1 minute before the end of her shift, Thomas Bridges appeared at the station for the second time that day with something in his hand. He set it on the counter in front of her. It was a sheet of paper, not a printout, but something handwritten, which was unusual enough in a digital hospital that she looked at it before she understood what it was. It was a sign. Simple. Block letters, marker on printer paper, unsigned. It had clearly been passed around before it reached Thomas's hand. The edges were soft from handling, the paper slightly warm from the people who had held it. It read, "We see you, Gray." Thomas said, "It started at the nurses' station on nights, passed through days. Every nurse on the floor signed it." He turned it over. The back was covered in signatures, cramped into the space, some with short additions, a thank you, a her name, a small note. And 4 of the residents, and 2 of the attendings. Miriam looked at it. She looked at it for a long time. She looked at the signatures, the names of people she had worked alongside for 3 years, people who had moved around her in the careful invisibility that institutions create for the people they have decided not to see. And she felt the things she had felt at the end of the previous day, in the elevator, looking at her reflection in the polished metal door. But larger now, more complete. She had not come to Metropolitan Mercy Hospital looking to be seen. She had come to do her job. She had come because she was trained to be in places where things were urgent and broken and required exactly the kind of attention she knew how to bring. She had not come expecting recognition or authority or the weight of a room shifting in her direction. She had come because there were patients, and she knew how to help them, and that had always, in every version of her life, been enough reason. But standing here now, holding a piece of paper covered in the names of people who had decided, not in a dramatic moment, not in a crisis, but in the quiet hours after a long day, reaching for a marker because they needed to say something, she understood that being seen was not the same as needing to be seen. That receiving recognition was not the same as requiring it. That a person could be self-sufficient in private and unassuming and still be moved by the simple fact of being known. She folded the paper carefully, twice, and put it in her pocket against her chest. "Thank you," she said to Thomas. "Don't thank me," he said. "I just carried it." She signed off her shift, said goodnight to the floor, walked to the elevator. 2 days later, Robert Calloway called back. The board had agreed to the structural change. The director of clinical nursing practice would hold binding authority over protocol implementation across all 14 consortium hospitals, subject to a defined review process for contested recommendations. It was not everything, but it was authority, real authority, the kind with weight behind it. Miriam accepted the position on a Wednesday morning, standing at the kitchen table in her apartment, in the same quiet she had always lived in, which had not changed and which she did not expect to change. The title would change, the scope would change, the floors she walked would be different, the battles she fought would be different, the scale of what she was trying to move would be different, but the work would be the same attention, the same documentation, the same refusal to look away from what she saw, the same absolute, unbudgeable conviction that the person in the bed mattered more than anything that stood between them and the care they needed. She gave Metropolitan Mercy 3 weeks' notice. In those 3 weeks, she worked every shift the same way she had always worked every shift. She checked on Gerald Henderson twice in step-down. He was discharged on the 4th day, walking under his own power, still making jokes about hospital food, shaking her hand at the unit entrance, with both of his, the way men of his generation shake hands when they mean it, with everything they have. She watched Callie's discharge summary come through the system. Cleared by Dr. Park, no residual cardiac abnormality, a note in the chart that said full recovery expected. She sat with Dr. Chen twice to work on the escalation protocol draft. She answered Reyes's questions about clinical assessment with the same patience and the same precision she had always brought to teaching, which she had always done, quietly, without being asked, because the residents who paid attention to her learned things they could not learn anywhere else. On her last day, Deborah Wills was on shift. They stood at the charge desk at the end of the day, and Deborah said, "You're going to change things at those 14 hospitals." "I'm going to try," Miriam said. "No," Deborah said, with the flat certainty of 22 years. "You're going to change them." Miriam looked at the trauma bay. She looked at the bays and the monitors, and the supply carts and the fluorescent lights, and the particular human atmosphere of a place where people came broken and were, when everything worked the way it was supposed to work, put back together. She had spent 3 years in this room. She had spent those 3 years learning how much could go wrong in the distance between a nurse's knowledge and a patient's outcome when the wrong people decided who got to be heard. She was going to spend the next part of her life closing that distance. In every trauma bay, in every department, in every hospital that had a quiet nurse with good instincts and a flag chart and a hierarchy that had not yet learned what Metropolitan Mercy Hospital had learned, in one long and irreversible afternoon, about the cost of looking past the people who were doing the actual work of keeping other people alive. Miriam Gray picked up her bag, said goodnight to the floor, and walked out. She had never needed anyone to watch her leave. She had never needed the room to notice when she was gone. She had spent her whole career doing work that mattered, whether or not anyone saw it, in the absolute conviction that the work itself was the point, and that conviction had never changed and would not change now. But the room noticed. Every person on the floor, without coordinating, without ceremony, looked up as she walked to the door. Not dramatically, not with applause or announcement, just looked up, witnessed her, let her know, in the simple, irrefutable language of human attention, that she had not been invisible here. Not really. Not in any way that mattered. That she had been seen, and that some things, once truly seen, cannot be unseen. That was enough. It was more than enough. For a woman who had walked into this hospital 3 years ago, asking for nothing more than the chance to do her job well, and who was walking out of it now carrying the authority to demand that the job be done well. For every patient, in every bay, by every person who had chosen, as she had chosen, to make another person's survival the central work of their one life. It was, in fact, everything. She walked through the door and into the evening, and she did not look back, because Miriam Gray had never needed to look back to know what she had left behind. She left behind a room that had been changed, and she went forward to change more.